Hello everybody! Thank you for tuning in to this first episode of my video series on environmental medicine. I am Dr. Laura Chan, and I'm a licensed naturopathic doctor and acupuncturist. My intention for creating this video series is to educate you about environmental causes of illness so that you and your family can feel healthy and stay healthy, not only in this moment, but for generations to come. I want to thank you for tuning in and listening, and I also encourage you to take a moment to thank yourself, since by taking the time to listen to this material, it means you are invested in improving your own health and wellness. In my experience, environmental factors are the most overlooked reason as to why someone doesn't feel well, is chronically ill, or has trouble losing weight. As a doctor who treats a lot of chronically ill patients who often feel like they fall through the cracks of conventional care, I came across the concept of environmental medicine sort of by accident, and as a last resort as a way to help my chronically ill patients get well. I take a lot of time with my patients to try to understand what is going on in their lives and to figure out why they are ill. Along the way, I was hearing stories along the lines of, well, I haven't felt well since I worked on that farm, or since I was in this office building, or within a few months of moving into that home, I started to get these nagging symptoms. Sometimes people would have diagnoses of chronic conditions when they came into the office, like fibromyalgia or chronic fatigue or Lyme disease, and they weren't getting any better with treatment. And I started to notice that when I would use therapies that supported detoxification, in addition to whatever else they needed, my patients would start to feel better, and chronic conditions would go away. Personally, I experienced this same phenomenon in my own recovery from chronic illness years ago. I had also been diagnosed with chronic fatigue and fibromyalgia and Lyme disease in my late 20s. I tried many different therapies, some of which were helpful, but the most significant change came when I worked on cleaning up my diet, cleaning up my life, and doing some basic detoxification. In order to help myself and to help my patients, I decided to pursue this topic further by taking very specific training in environmental medicine, and it has dramatically changed the way I understand illness and how to get people well. The basic idea is this: what we are exposed to day after day contributes to illness or wellness. The good news is there is a lot we can do about it. In this series, I'll address how toxins make us sick, and then what we can do about it. In my experience, toxin-related causes of illness are one of the most overlooked reasons as to why someone doesn't feel well, have a chronic illness, or have difficulty losing weight, which is so common. Exposures from the environment can be the root cause or a contributing factor in the development of many common health conditions. Throughout this video series, I'm going to unpack this topic so that you see what I'm talking about. Whether you are someone who is healthy and wants to stay that way, or whether you've been struggling with poor health and want to feel better, there will definitely be information in this series that is relevant to you and to the people in your life who you care about. Environmental medicine is a branch of medicine that looks at how our health is impacted by our environment. The air we breathe, the food we eat, the water we drink, the places and spaces in which we work and live and play and sleep. Environmental medicine looks at how toxins and toxicants in our environment affect our health. In video 6 of this series, I'll take this concept a step farther and talk about how our emotional and energetic toxins also play a significant role in our wellness. To start with, I want to do just a quick vocab lesson to clarify something. What are toxins and what are toxicants? Toxins are natural products, such as the ones found in poisonous mushrooms, snake venom, or mold. They come from nature. Toxicants are man-made products or artificial products that are introduced into the environment due to human activity. An example would be industrial waste or pesticides. Another point I want to clarify is this. In this series, I am not talking about the huge environmental exposures that could put someone in the emergency room. For instance, if a child drinks a cleaner that's under the sink or someone gets a large amount of chemical spilled on them at work, that's not what I'm talking about here. Those are emergencies that need to be dealt with at the emergency room. Instead, I'm talking about chronic illness. I'm going to explain how low-level, everyday toxin exposures can and do contribute to common health conditions, and how fixing these exposures can help us recover from these chronic ailments. I'm going to be talking about the less acute and less obvious environmental illnesses, the ones that affect most of us, you, me, and the people we know and care about. Most people don't tend to think that our neighbor, the software engineer who works in an office down the road and lives in a small town in a nice house, may also be affected by environmental illness for reasons many of us don't think about. We don't tend to think that when our hairdresser tells us about her aches and pains, her autoimmune condition, or her frustration with not being able to lose 10 pounds despite her efforts, that it may be partially or mostly related to chronic environmental exposures. We don't tend to think that a teenager who complains about PMS might actually also be suffering from toxicant exposures. Rather than putting the hairdresser on medications to treat the symptoms, or the teenager with PMS on birth control pills, wouldn't it be great if we could just change a few simple things in our environment, or our diet, or utilize a few simple and safe detoxification strategies, and then voila, the problem goes away? While conventional treatment and medications have a really important time and place, my goal is to get to the root of the problem, rather than just treating the symptom with medications that can often have their own side effects. Let me tell you a story about a patient of mine. This was a man in his mid-30s. When he came to my office, he had been diagnosed with Lyme disease and had been treated for several months, but he wasn't feeling any better. Since he was new to me, I wanted to understand his health history. So I asked a lot of questions. What are his symptoms? When was he diagnosed? What had he tried? What else had been going on in his life at that time? His current symptoms were headaches, sinus pain and pressure, fatigue, dizziness, muscle pain, and low libido. As it turned out, the year prior to his diagnosis of Lyme disease, he had been living in a home in which he was exposed to mold, lead, and a gas leak from the furnace. Since he hadn't been feeling any better on his treatments, we agreed to change course and focus on treating the environmental exposures. Fortunately, he was able to move to a new apartment, and we supported his body to safely detoxify. Within a few months, all of his symptoms had gone away, because we had treated the root cause of his problems. I want to talk a little further about root causes. This is a really important foundational concept to understand as we move forward here. While there are many, many types of illnesses and symptoms out there, generally speaking, there are only a few root causes of illness. Really, just a few. Isn't that cool? One of these root causes is toxin exposure, and this is such an important one and it often gets missed. To help us think about and remember the basic root causes of illness, I developed an acronym that I'm going to show here, and I call it DELIGHTS. D is for diet and digestion. E is for our emotions and energetics. L is for our lifestyle. I is for our immune system and infections. G is for genetics. H for hormones. T for toxins. And S for structure. If something goes wrong in any of these areas, it can certainly lead to illness, sometimes acute, sometimes chronic. And so these are the most often root causes of illness that I see. And addressing all of these and making sure we optimize wellness in all of these can help someone get well. In this educational series, I'll be focusing on the T for toxins as a source of illness. But it's important to remember that the T for toxins actually affects every other category in this model. For instance, look at diet. We can either choose foods that have toxins in or on them, or we can choose foods that help us detoxify. Think about lifestyle. Perhaps someone smokes or has a hobby that puts them at exposure to certain toxicants, and so on and so on. We're all exposed to toxins and toxicants all the time. It's just part of life in our post-industrial environment. So some might ask, well, what's the big deal? I feel fine. This is a good point. In general, our bodies do have natural detoxification systems that should work to keep us healthy. However, if we have either a large exposure to a toxin or toxicant or repeated exposures to low levels of toxicants day after day, and we don't do anything about it, this can start to overwhelm our body's detox systems. And then we start to develop symptoms and problems. These problems may seem so mild at first that we hardly notice. But over months to years, chronic symptoms and chronic diseases can develop. Many people will write this off to aging. Oh, I'm just getting old, or yeah, that runs in my family. Personally, I don't love these justifications for illness. I truly believe that most of the time, we should be able to be healthy and vital well into later age if we take care of ourselves and pay attention to all of the root causes of illness, optimizing wellness in each category. The good news is that many of these chronic aging conditions are preventable or treatable, or at least the severity can be lessened significantly. So don't you want to feel healthy now and stay healthy and vital as you age? I know I do. So here's the really juicy info. What kind of conditions arise from toxin and toxicant exposure? Here's the scoop. Environmental toxicants affect 3 systems in our bodies: our immune system, our nervous system, and our hormone system. Let me repeat that. Our immune system, so in other words, our body's natural defenses, our nervous system, like our brain and our thoughts and our mood and our nerves moving through our body, and our endocrine system, or our hormonal system. The more we're exposed to toxicants, the more these 3 systems can be impacted, and symptoms or diseases can and will develop. Remember the delights model? Right in there we had I for immunity and infections and H for hormones. Think about it. If toxins that we're exposed to affect our immune system, sometimes by lowering our immune system, sometimes aggravating our immune system, it can lead to symptoms or diseases in these areas. If toxins affect our hormonal health, it's going to lead to conditions of out of balance hormones. It's all connected. When these systems are affected, it can contribute to many different diseases and symptoms. Here's a partial list of conditions and symptoms that can often suggest an underlying toxin burden. Chronic headaches, allergies, which are an overstimulated immune system, asthma, obesity, weight gain or difficulty losing weight. This is a really significant one. Chronic fatigue, fibromyalgia or pain all over, chronic infections such as chronic Lyme disease, fungal infections, chronic viral infections. Again, that's all related to our immune system. Autism, depression, those two both being related to our nervous system. Diabetes and infertility and hormonal imbalances like PMS, endometriosis, thyroid disease, breast cancers, and acne, all related to our hormone system. Chemical sensitivity, autoimmune diseases like Hashimoto's, rheumatoid arthritis, lupus, Sjogren's. Again, that's all related to our immune system. Immune deficiencies like low white blood cells, bone marrow cancers, Parkinson's disease, which is a disease of the nervous system. As you can see, this is a long list, and it's not a complete list, but it's enough to give you a sense of what I'm talking about. And these conditions that I mentioned are really common. I bet you can think of several people in your life who have at least one of the conditions on this list. Environmental medicine takes into consideration the root causes of illness. It looks at how what we eat, drink, breathe, and put or get on our skin can significantly contribute to whether we are healthy or unhealthy. While some of us might be only slightly affected by environmental toxicants, and some of us may be much more profoundly affected, this is an issue that I believe we all need to be aware of, because our health and the health of future generations is at stake. In this video, I discussed what is environmental medicine and environmental illness. Stay tuned for the next videos as I discuss what is it in the environment that makes us ill. And in future videos, I'll discuss what we can do about it so that we can feel healthy, stay healthy, and keep the future generations healthy. Stay tuned.